Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What are some of the common problems we face in terms of healthy aging?
There are a number of them. Some of them are exact same problems that pose a threat to other people, and those include obesity, inactivity. Inactivity especially is a problem for older folks. It used to be thought that people got weaker sometimes when they got older, but it turns out they're just not being active, so the muscles atrophy. And good research has shown that people can build up those muscles again and decrease their risk of falling through things like exercise. And obesity is a problem for everyone, but in older persons in particular who already may be at risk for things like diabetes, heart disease, it's especially something we want to avoid.
What are some of the preventative steps we can take to ensure healthy aging?
All things in moderation. Never smoke, or if you are smoking, stop right away. A good, healthy, balanced diet focused a lot on fresh fruits and vegetables, modest amounts of red meat, good amounts of, you can have lean meat and fish, and then activity. Exercise, getting out there at least 3 times a week, walking for 30 minutes, and importantly, staying engaged. One thing we know that is very important for people staying mentally active is to be engaged in other activities with people. You know, some people talk about doing crossword puzzles, but it's meaningful activities that often involve other people that really help keep us on track.
For those of us with aging loved ones, what can we do to make their lives easier?
Well, I think there's a couple things. One we pay a lot of attention to is safety in the home. As people get older, they may have some more problems moving around. Things like eyesight and hearing may become a problem. So we worry a lot about safety, and that includes things in the home people may trip over. Do people know how to access emergency services? Things like smoke detectors. Do they have an alarm that someone can actually hear? So things like that.
What's the #1 problem you see in terms of overall health issues with your patients?
Medications. Most of my patients come to me on large number of medications, and while medications can be very beneficial to people, we also know that the risk of medications increases as people get older. And a lot of what people think are diseases or conditions are actually side effects of medications. And medications can cause things that people may think are due to other problems. You know, it may not be Alzheimer's, it may be confusion from medications. It may not be that someone's getting weak causing a fall, but medications. So reviewing medications, making sure they're appropriate, getting people off inappropriate medications is one of the job ones we do as geriatricians.